Welcome to our second Emotional Toolbox session entitled Expanding Your Emotional Toolbox During COVID-19. I'm Danny Cambier, one of the co-chairs of Administrative Management Professionals Group. AMP is hosting the session alongside the Diversity and Inclusion Certificate Program alumni leaders, Staff Assembly, and 4CI Staff Subcommittee. Thank you to my planning committee colleagues, Brooks Bigart, Colette Onoko, Saika Ann Qureshi, Deb Ryder, and Janice Villanueva. The panel is brought to you by UCSF COPE and the Department of Psychiatry and Behavioral Sciences. We will be recording this session today, and we will have a link posted on the Office of Diversity Staff Resource Days, AMP, and Staff Assembly websites next week. Today's event and all remaining Staff Resource Days events are being live closed captioned. Thank you to the advocacy efforts of Kristen Amelie, Jill Walters, and efforts of Jen Mannix. Please click the closed caption icon to view live captions. Captions provide a written version of what is being said during the webinar. This is helpful for people who are deaf, hard of hearing, or in noisy or quiet environments. Please ask questions throughout the presentation using the Q&A tab. To start our session today, we have Dr. Alejandra Rincon, who is the Assistant Vice Chancellor and Office of Diversity and Outreach Chief of Staff. Dr. Rincon is the author of Undocumented Immigrants in Higher Education, Si Se Puede, and the curriculum lead within the Latinx Center of Excellence Curriculum Core. Welcome, Dr. Rincon.
Thank you so much for this invitation. Thanks to all of you for being here today. What a great way of spending our Friday afternoon. This is an unprecedented time in our global history where we have spent a year confronting almost constant and changing fears, challenges, and uncertainties. I think whether you're a member of the staff, the administration, a healthcare provider, everyone has been affected by this pandemic in some way. We have experienced so much in the past year. For many, our struggles are ongoing and we feel overwhelmed and exhausted. That's certainly how I feel right now, but I'm so energized to be with all of you today. Yet we press on. Together, the employees of UCSF Health have achieved tremendous things to our communities and each other, and we appreciate all of their work. We're thankful for you. We know that you're hardworking, dedicated, and passionate about your work, and what you have overcome personally to achieve these things collectively is seen and appreciated. We all have sacrificed a lot, so thank you for all that you've done. Therefore, we're taking this time to encourage you and to help you take care of yourselves. We have partnered with UCSF Employee Coping and Resilience Program to bring you speakers to encourage you to be compassionate with yourselves and others as we're all mindful of the tremendous stress that we continue to face. Certainly on behalf of the Office of Diversity and Outreach and our Vice Chancellor, Brittany Navarro, we welcome all of you for this session today. It is my pleasure to introduce the speakers, which hopefully you are able to see on the screen. We'll begin with Dr. Kumar with lessons learned by a psychiatrist during a pandemic, followed by Dr. Ekman with a session on burnout, inside and out. And then last but not least, transforming trauma, how trauma-informed, equity-promoting workplaces can heal us by Dr. Doral. Thanks to all of you again and to our wonderful speakers. Welcome, Dr. Kumar.
Hello, everyone. It's really great to be here with you. I wasn't quite sure what to call this talk. This is really a conglomeration of the many things that I've learned over the past year. I have been in a position of privilege as a psychiatrist, but also working with UCSF COPE, getting a chance to connect with over 60 parts of our organization and hearing about how the pandemic has affected them, being in town halls and small groups and hearing many UCSFers describe their struggles and what they're doing to overcome these things and the things that they've been learning. And so I wanted to kind of distill some of that and share that with you. And I wanted to start with a slide I've used at almost all of my presentations for this past year. This slide is officially a year old. This is kind of describing all of the emotional and interpersonal effects that we experience, sometimes in a week, sometimes in a really bad day. And I'm always surprised how this slide from Elisa Armstrong has continued to be so incredibly timely in terms of everything that we just continue to manage. And so with these just huge, big, and oftentimes negative emotions, like how are we getting through this? So I am a psychiatrist, among other things. I don't know that I wake up in the morning kind of self-identifying as a psychiatrist, but I did want to tell you a little bit about myself since I'm going to tell you what I've been learning. So in kind of really broad strokes, you know, I'm a psychiatrist, I'm a leader, I'm a provider, I also have people that I report to. I'm a caregiver, I'm a wife, and I'm a mother of a 7- and 9-year-old. I'm a woman during these difficult times. I have a mixed Latinx background. And, I'm also, a friend and lucky to have friends who've cared for me and a colleague. And those are just some of the things that kind of define kind of who I am in this world. But I would say for most of the time in the past year, this is how I felt. I'm, the lady wearing not totally work appropriate attire from the waist down, with absolute chaos around me. And then I hop on my Zoom and everything's supposed to be okay. So now you know what's really behind this virtual screen. So how am I managing to wake up every day and do all the things that I have to do? Like I said, I've learned a lot from you in the past year about help, managing time, the role of humor, truths I need to hold on to, compassion and gratitude. I'm hoping these are like a good primer for just to prepare us for our other speakers. So the first one, help. Help? Help! That's, oftentimes how it comes out for us. So the first thing I want to encourage you to do is ask for help, accept help, and offer help. It seems super obvious, except I know that we are terrible at asking for help. Often the people that we need to ask the most are the people that we struggle to ask from. People who are at work in positions of power, it's really hard to ask for help sometimes. People who, normally we're relying on, it's difficult. But there are many places to ask for help. And what I have learned over the course of this past year is that as often as I needed to help, there was someone who was grateful to give it and actually really appreciative of the opportunity when they don't get to do all the things that they normally do to be able to offer help. And so I really just want to encourage you to expand all the different places that you can look in terms of connecting with people. I have patients who often say they feel so alone, but I know that there's many people out there who are feeling alone and really need each other and to connect with one another. And so even if you don't feel like you have a lot of family or friends around, there are faith organizations, coworkers, neighbors, volunteers. There's people who literally just like to do this in their spare time. And then of course, professionals, communities, and organizations that are really all about connecting and offering help. So time, we don't have enough of it for all the stuff that's been on our plate in the last year, and certainly for all the emotions and difficult things that we have to process. So, the first thing is, I know you've heard this, but we always need the reminder, is that you are a priority. Folks at UCSF all have had more work to do, less people to help, and more pressure in the last year. That's true for almost any department that you're in. And yet we know if you're pushed too hard and you don't have enough time to care for yourself, you're gonna burn out or leave or trying to look for something else. We really value you. We really need everyone here. And so I really ask that you remember to put your own oxygen mask on first. And then really take some time to think about what is important, really, and do this frequently. And reflect, how have I been managing my time? What has been giving the most time? You know, these are the things that are most important. Maybe it's family or friends, but in my busyness, how have I managed to make that a priority and to really schedule it? Being so busy, I've learned this from other caregivers, that it's really helpful to make time do double duty. So try to find things that are good for your well-being, like, you know, walking, you know, taking the dogs out, visiting a friend, or something that you can do while exercising or talking on the phone, sort of like helps it easier to make that time for well-being when you kind of feel like you're getting something off your to-do list as well. And then after you've done this, then you need to sit back and be reasonable. Are all the things that you've set to do, like, can you really accomplish that? And I think it's important to, you know, be honest with yourself about what you can accomplish, because there's nothing worse than setting a to-do list that you know you can never get through. So I am a psychiatrist, and I'm going to talk a little bit about Freud. I actually didn't plan this, but then I realized that Anna Freud was right. Humor has been hugely helpful to me. She suggested that it was actually one of the highest forms of healthy defense, because using comedy can directly help us to connect with the thoughts and feelings without the same type of personal discomfort that we have or hurting others. And really good, mature humor allows us to really look at some of the most painful, difficult, awkward things, because it brings such a fresh perspective. So one of my colleagues, Dr. Hannah Potvin, always manages to send me the right meme at the right time, just when I am about to be like, how am I going to make it through the day? I'll get a text message. Look, they put me on the cover of our journal this month. You know, it's a journal on well-being, burnout, and depression among the state of North American psychiatrists. Or, you know, planning to celebrate New Year's, or as I'm lamenting that I have no place to go for vacation, she sends me a stack of Lonely Planet journals about, cobweb removal, staying healthy at home. And then of course it's Girl Scout cookie time. And so it's helpful to learn that they are actually a food group. So then I don't have to feel so guilty about eating them. So I think truth is really helpful. I'm just going to kind of go back to this. I think any situation where you can bring laughter in, whether it's appropriately, but like, you know, a difficult conversation with somebody about politics, and you can sort of laugh something off. I think Dr. Fortuna talked about this in our last webinar. You know, to keep it light and to keep that perspective can be just really helpful. And sometimes things are just so exhausting and hard. There's not really a lot else to do except to try and find some humor and keep going. So some trauma-informed truth. Dr. Dorado is going to talk to us a lot about trauma-informed thinking. But I wanted to share some things with you that I've learned. In my position, I've got to hear, you know, the kind of executive levels of UCSF come out with new policies. You know, I've watched my children's students trying to figure out how to do virtual learning. I myself have been trying to figure out how to do virtual healthcare for the past year. And this is still true. We are all just making this up. We do not know the best way to do all of this. And I think it's really helped, because it's really easy to get frustrated because people do things and it's wrong and it doesn't really make any sense. Or even hard on ourselves, like, why can't I figure out how to do this better? Because we don't know. Like, it's a year in and there's still more challenges. We're still kind of figuring this out. nobody is doing as well as they seem. So I showed you what it looks like underneath the veneer of my virtual background and my wool jacket. As a psychiatrist, I have an opportunity to see people from all walks of life. And in my role doing COPE, I've talked to people all across the university. Some of them, you know, are so fancy and have these really, you know, exciting, high-profile jobs. And what I have really learned is underneath all of it, like we are all just having a hard time. Pandemic life is hard. And really, I haven't met anybody that's just rocking it. And then this is really one of my favorite things from kind of trauma-informed thinking, which is that everybody has a story. When somebody does something and it makes me mad or frustrates me or just makes life hard, it's really easy for me to come back with what's wrong with them. But what I've learned from trauma-informed thinking and knowing that everybody has a story is to be curious. Oh, I wonder what happened. I bet I have no idea what's, you know, I'm only seeing the tip of the iceberg. And when I extend that to people, I find I also am more compassionate with myself as well. So awesome, also awesome. Grace and compassion. So Dr. Ekman's going to talk more about this. But, you know, there's some principles and some types of therapy, which are really that, like, I'm pretty sure that you're doing the best that you can. And I think this is true. Most people that work at UCSF, really, I've met many, are just amazing, hardworking, passionate people. It doesn't matter what job you are, like people come to UCSF because they want to be part of something. And so I know that you're working really as hard as you can. And like, sure, we can always do better, but I think it's important to remember that, like, even when we make mistakes, like, we were doing our best. And then at the beginning of the pandemic, people kept on saying this, and I really hated it. Like, it's not a marathon, you know, it's a marathon, it's not a sprint. And I was like, are you kidding me? I can neither sprint nor run a marathon. This is a horrible analogy. And so the thing I've come up with, which I think I learned just being a mom and taking care of small children, is that often success in life is really just small steps every day that nobody sees, nobody acknowledges, and yet they're really important and keep us going. And we need to validate ourselves that those small steps, sometimes they were hard, sometimes they were easy, but we're making them. And then mistakes happen frequently. I call this the Brittany Principle. Oops, I did it again. I make a lot of mistakes. I often do them in front of people, my team, colleagues, patients. And I just try and use it as an opportunity to, like, one, acknowledge it and say, I'm sorry, but also to remind them that when other people make mistakes, I'm going to work really hard to be gracious with them and to create a culture of forgiveness. And because when we extend compassion, it brings so much relief to others, for others to be in a safe space. And then finally, there's so much difficulty spending time with these really powerful, positive emotions is critical. And so making, part of putting on your own oxygen mask first is making sure that you are doing the things that you love as well as you can. We know the limits on those things are endless. But if it's nature or the beach or art, these are really, really important. This is actually some artwork that was for Black History Month. And I love how it celebrates diversity. And then I love this quote from Aesop, gratitude turns what we have into enough. And I certainly have learned that just being really joyful in these really small things can be really helpful. I took a mental health day recently. I had no place to go and really nothing to do, but I potted some plants and I thought I'm gonna really slow down and enjoy this as much as I can. And you know, so I've been telling myself, look at this plant, doesn't that just bring me so much joy? So whatever it is, taking time to have gratitude, because we can always have things better, but really slowing down and appreciating those can be really helpful. So I hope you enjoy those lessons that I've learned. And the last thing I wanted to say is if you're thinking to yourself, yes, I do all of those things, and I'm still so exhausted, I'm with you. And I'm really excited to hear from our next speakers. And so, we have Eve Ekman here, who is a social scientist and emotion researcher, and she's going to be talking to us today about burnout inside and out. Thank you, Eve.
Thank you. Can you hear me well and see me well?
Yes.
Both of those things, wonderful. Now that I'm in this official PowerPoint, I can't seem to get out of it, so I'll just go with it here. Yeah, I just want to really say I'm super grateful to be here with you all. Really appreciate the opportunity to connect and share some ideas and space. I want to recognize that my current home office, where I spend 100% of my time, is on the unceded ancestral land of the Ohlone people here in San Francisco. And I myself, grew up in this city and on this land, and I'm so grateful to be here during this time when outdoor space is just one of the most precious things I find around me. And it's enormous amount of gratitude. So let's go ahead and get started here. Trying to figure out how to, So before we begin, I actually want to take a moment and acknowledge the motivation and intention that all of you had to come here. If it's comfortable for you and you can gently close your eyes, otherwise just have them softly focused, open. And if you have anything in your hands, I invite you for just a moment to put it down. And as you're putting down whatever is in your hands, imagine as though you were also putting down whatever else is in your mind. The plans for later, the thoughts of the past, of what has happened today. Take what might be your first full intentional breath of the day. And notice that being here, choosing to show up, whether live with us here now or at a later time at the recorded session, that showing up here in and of itself reveals your natural capacity of compassion. This simple impulse of caring about your own well-being. Nothing here needs to be generated, nothing here needs to be extended, just noticing what is always already here. A deep sense of caring for your own well-being. Feel as though that's a pilot light at your heart center, always available. Maybe dimmed by day's activities, frustrations, complications, but never absent. And if your eyes have been closed, just gently blinking them open, not needing to uproot from this sense of deep-seated care for yourself, but just coming back into our shared space for a bit more discussion. So you all are here and not somewhere else because of a care for yourself. So awesome. I'm operating on really good territory to get started here. So I am a contemplative social scientist with a background here at our very own UCSF. Joyce Dorado, who I'm so grateful to be sharing space with today, was a training director of mine. We won't say how many years ago. It's far too long, at San Francisco General Hospital when I was doing my internship in social work. I was also a social worker at the San Francisco General Hospital emergency room, then went back to school actually to study well-being and burnout among healthcare providers, and really looking at what are these amazing protective mechanisms that allowed myself and my coworkers on the majority of days to show up with incredible compassion. So I wasn't studying burnout because it was so prevalent and it was everywhere. I was studying burnout because, yeah, when people reach that level of true cynicism, and we'll talk about that a bit, it was hard. It was hard for them to do their job, and they made a big impact on everyone around us. And as you see from this little photo, which is showing here, like the whole team-based effort in the emergency room. And though this, of course, is a bit different during our pandemic times, most of us are not operating as a solo individual. We're connected to many other colleagues, many other people. And so when we think about our well-being, we can't think about it just as us. It has to be really within community, the well-being. So you'll hear me kind of bring that up a number of times. You see here Greater Good Science Center on the bottom. I'm a senior fellow at the Greater Good. I was formerly the training director there, really focusing on how do we bring the science of well-being into our everyday life. So I was the training director there the last couple of years, and actually did my postdoctoral time also at UCSF at the Center for Integrative Medicine. Some of you may be familiar. Again, really working on burnout, and at that time working with physicians and looking at how do physicians in training, what can they do to in some ways complement the stresses of their daily life, not eradicate, but complement the stresses in their daily life with pro-social tools and skills of emotion regulation. It's a very fancy term, so we'll get right into them and what they mean. Greater Good Science Center, as I mentioned, we kind of bring these tools into everyday life that's based on contemporary psychology and neuroscience. I'm showing you here just a couple images from our website, where every single week we are publishing new articles that talk about things that range from what's going on with teens and how to help them during the pandemic. I really appreciated that Margot brought up that she's not only a psychiatrist, that she has all these roles. And again, when we're thinking about our well-being, it's not just at work, it's in all these domains. It also talks about kind of the divisive and polarizing energies of this time, how we can address and look at the ways we can feel more connected to one another. I loved Margot's suggestion of curiosity. Can we be curious instead of judgmental? It's a nice exercise in practice, or at the very least, an aspiration. And the Greater Good also has a host of free online tools for making pro-social connection. So how do we write a gratitude letter with real specificity? How do we reflect on gratitude in our own life? And there's even a downloadable set of PowerPoint slides called Gratitude as Medicine. And this is something that if you'd like to share with a small group of people, you can refer to these slides. It has a lot of data and tools, which I won't go over here since you can do so on your own. And they're very self-explanatory, but it's helpful because as I saw already in the chat, a very meaningful question, which was, I am working with someone who's incredibly angry. What do I do? How can I actually do my job while this person is expressing such toxic and difficult emotional energy? And I wish I had a short answer for that, but I will say that developing our relationships with colleagues where we can is one of the most powerful tools of resilience. So not just our own inner resources, again, enormously important, but our ability to have dynamic, strong relationships with our colleagues. And what this means is that we're focusing not just on venting, which actually, meaningful gossip can be a very helpful way of communication, can make us understand some of the hazards or dangers in our work environment. However, it has a kind of one-dimensional tone. If all we're doing is kind of venting and expressing, we may not be developing these other aspects of our pro-social nature. So when I say pro-social, I'm talking about these natural emotional tendencies, meaning we don't have to learn these. This is actually, some would say, what we're here for. That when we are born, we are hardwired for connection, for gratitude, for compassion, for kindness, even for play. meaning there are different neural networks that are activated when we engage in these different kinds of activities. And they're called prosocial because often these are enhanced and increased when we do them with others. Awe is just such an incredible one in the caring profession. We have such an amazing front row seat. Sometimes awe can include the awe of someone's life and its fragility and the preciousness. And we can also think of, another aspect of awe, which is just how we can find awe in the mundane every day. Like this office, as I said, which I spent 100% of my time in. How can I find awe here? So we can go from the grand into the small. And on the Greater Good Science Center site, completely free of charge, we have little activities for each one of these. These are trainable skills. These are not just personality traits. I either was born as a grateful person or I wasn't. Absolutely not. We can increase these. And again, the more that we share them with others, the better. So I started with the good news, but let's really talk about burnout. It's no surprise to any of you. You know these stats. I myself have been in the position of collecting data and really looking at, indeed, at UCSF, high incidence of burnout. Nobody is surprised. There's also high incidence of depression and even suicidality. Maybe some of you all have had colleagues who have succumbed to that real dark night of the soul and either attempted or succeeded in suicide. And just a moment, whenever I say that, I feel so deeply moved by the reality of that suffering and how hard it is day in and day out to live with that sense of depression and overwhelm. And so when we think about burnout, of course, we're thinking about enormously important consequences for the individual. And also there's a lot of other kind of psychosocial aspects. Of course, it could impact patient care. It could impact our health behaviors. Are we choosing addiction or distraction? Is it compromising our relationships with those we care about? Now, when we think about burnout, right, it's multifaceted. It's not just one thing. There are individual stressors and individual forces of resilience. So sometimes we look at burnout and we try to identify within one person, what are the coping resources they have access to? In the pandemic, that has been definitely narrowed for many of us. There also are some of us who kind of naturally can deal with less sleep, right? Or have some physiological relationship to stress. It may be like myself, I currently am working with a herniated disc, which that is an area where I succumb to stress eventually. Right? Lower back and tummy, we see that a lot in integrative medicine. And there's also this amazing strategy or capacity with a coping resilience at an individual level is finding the meaning in what we do. And I'll talk about that just a bit at the end, but as a highlight for it here now, that one of the greatest attributes of working in healthcare is there's so much meaning. There's so much meaning. Then when we think about the roots of burnout at the department or the team level, of course, your immediate close colleagues. And that again was for our first question to the panel of what do we do when we are working with someone who is toxically expressing difficult emotions? That can be and has been found to be one of the #1 sources of burnout. Even amid difficulties of patients, resource limitations, having a coworker who's truly cynical or at worst bullying can be enormously difficult. Also, what's our autonomy? How safe do we feel in our work? And then we get into this huge aspect of structural. We have, of course, aspects of historical inequality, enormous bureaucracies, the electronic health records, how difficult those are. A lot of these contribute to our daily burnout. One thing it's really important to say at the very kind of onset of discussing burnout is that the occupational distress being experienced by clinicians is largely precipitated by a dysfunctional environment. It is neither a failure of personal resilience nor a medical condition. So I just want us to take that in. This is neither a personal failure nor a medical condition. Multifaceted, many different ways which burnout comes up. So when we think about
Dr. Ekman,
yeah.
so sorry to interrupt. I think something happened and it's been a little hard to hear you. I don't know if you could just check your sound real quick. No worries, these things happen. we love what you're saying and don't want to miss you.
How about now?
Oh yes. Much better. Awesome. Thank you so much.
Do you want me to go back at all? Or it's okay?
No, I think you can keep going.
You can hear me?
How about now?
That's great. Thank you.
It seems as though when I play, you can't hear me well. When I have my full. Is that
we could hear you. We could
enough?
hear you right at the beginning. Even though you were playing. So I'm not sure what happened.
Okay. I'll try playing once again, and if it doesn't work, maybe this is okay or sufficient.
Yeah, I think that's fine.
Okay, how about now?
It's working. Thank you.
Okay, great. So there are currently more than 14,000 manuscripts on burnout in PubMed. 14,000. And yet, this meta-analysis that came out in 2018, which was really trying to look at what are all the interventions, what are all the sources of burnout. There's always the ongoing debate. Do we need to help individuals or do we need to change the entire organization? And essentially they said both. There is no conclusive evidence that it's either one or the other, which is great because here we are today, all of us, of course, many people here are working on their own to change policies, to change structures. But what we're working at today is how do we do these individual level resource building, whether we're doing that just with ourselves or with colleagues, as I mentioned before. And one way we can understand burnout and the roots of burnout is emotional distress. So the classic understanding of burnout is that it includes a feeling of emotional distress, lack of meaning, and then cynicism. And when we get specific with emotions, we're not trying to say that what we need to do is get rid of emotions, or even that some emotions are bad and wrong, right? On a day-to-day basis, even in the best of times, all of us experience frustration, disappointment, anxiety. What we look at when we're trying to start working with or developing emotion awareness is, can we become aware of how we respond to our emotions, our enactment of our emotions? Can we let that anger actually be channeled in a way that is constructive? So I am very angry about ongoing injustice throughout this world. Does that make me, feed my feelings with food that is later unhelpful for me and I can't sleep? Or does that anger make me speak out, right? Maybe find the role and the place in which I can actually enact that anger in a helpful way. So whenever we're talking about looking at our emotions and developing emotional awareness, it's not to get rid of, or even to say that any emotions are wrong or bad. Emotions are designed to give us an important message about our environment. They're really there to share that with us. So when we think about the kind of difficult emotions that can arise, especially in the healthcare setting and what has been covered before, there's emotional distress, which includes empathic fatigue, feeling the difficulty of those around you. We can also have this kind of emotional resonance. This can be good, but often it's bad. So other people are in a difficult, cynical mood, you become in a difficult and cynical mood. Also, this term emotional labor, really important for us to keep in mind that, of course, part of our day is the actual maybe treatment or presence with other people, whatever is the, tactical. And then there's the emotional labor, meaning how we have to show up by suppressing some of our feelings and amplifying others. And just as with physical labor, we have to kind of find ways to lift that doesn't strain us. And then we have to recover. And we also have a sense of how do we, give ourselves rest after that emotion labor. Same, right? We have the exact same thing with emotion labor than physical labor, except we don't have OSHA for emotional labor, which is maybe something that needs to be looked into. And then there's emotional incivility. You see this a lot, really beautifully done in the nursing literature: rudeness, bullying, aggression. So of course we see that there are these challenges with emotions at work. And when we think of what are the strategies that we can do to work with our emotions, there's three I'll just mention here. I don't have a lot of time, so I'll kind of point you of where to find more, but to highlight that somewhat counterintuitively, one of the best ways through our emotions is actually to understand and name them. So instead of, I just feel bad, today was terrible, I don't even want to talk about it, get really specific. Today I felt frustrated. It was hard. It was like my whole body was heavy. Or there was a sense of real isolation, even though I was with my other colleagues. By naming that, either reflectively at the end of the day or even in the moment, we actually get this really powerful space from our emotion. This is something we can do all the time, right? We don't need our 20 minutes of rest and peace and meditation. How wonderful if we have it. But here we can name it on the spot. Also increasing our pro-social emotions. Again, Margot mentioned this. How do we savor what's good? How do we enjoy? So we have a capacity to extend our negative rumination and worry about what's wrong. We can apply that exact same strategy to what's good. So really, really letting whatever is good feel good. Sometimes for those of us in the caring professions, we don't feel like either that's a good use of our time, or how can we feel good when so many, especially those that we serve, don't have enough, are feeling difficulty or challenge. So I think one way of considering savoring, kind of brought forth by contemplative traditions is, this feels so good. This sunlight on my face, this warm cup of tea. I wish that everyone had this feeling that was so good also. So you include others in your enjoyment. That can extend it and really help have that pro-social emotion go farther. Also, as I mentioned at the very top, there's really no amount of gratitude that's too much. Having gratitude, expressing it, being very specific. So not just, I'm grateful, Margot, that you invited me to this panel, but Margot, I'm grateful that you reached out and was so clear with me of like what was at stake in this panel, who was going to be here so that my motivation could be so clear. Right? That's such a different feeling, the specificity of our gratitude. And then compassionate reappraisal. And that's the last thing I'll talk with you about today. So when we're thinking about the challenges and difficulties of our everyday life, it can be very easy to get into, again, that kind of blaming or self-shaming, like, oh, that was so hard, I feel so bad. The compassionate reappraisal is one in which we really use this basic definition of compassion, a caring about suffering, whether for ourselves or for others. So when we think about compassion, it's this feeling that arises in witnessing another's suffering and motivates a desire to help. And then for ourselves, it's applying that same heartfelt concern towards ourselves and recognizing all of us are in this. So we are all in these same very struggles. No matter how unique it feels to us, someone else is experiencing something very similar. So when we're applying the compassionate reappraisal, again, we can do that for another person. Why are they acting that way? Understanding that as some challenge they are having. And then in ourselves, when we watch those mistakes that we make, or when we feel as though we missed an opportunity, how do we really apply the sense of heartfelt care to ourselves? And we see that, there's like a counterculture, one that's the opposite of bullying and negativity. When we have this compassion, starting, of course, here, a real sense of deep care for ourselves, what is called forging the inner channels of compassion. Compassion for our colleagues can be easy, can be hard. Maybe start with the easy people and radiate outward. And then this is really heroic level, but can we have compassion for these dysfunctional systems? Not because they deserve our compassion or that compassion is an allowance, but because our anger and negativity towards them is draining. So we recognize that these systems are built to help each other, and they do not succeed very often. So the compassion is really for, wow, these systems which someone somewhere thought were a good idea, got so mixed up over so many different motivations and needs and objectives. So it's a very high level, but just as a thought experiment. And when we think about what are the benefits of compassionate work, we actually know from the evidence that it improves our physical health and our stress resilience physiology, literally lowering our blood pressure and increasing or decreasing our levels of depression. That compassion is really good for survival. It really helps us collaborate with others. It makes us happy and optimistic. It improves our self-esteem and optimism. I think some people believe that when we're compassionate, we're like this marshmallow and that we're just gonna get burned up in the flames. But compassionate doesn't mean being detached or passive. It doesn't mean ignoring injustice. It doesn't mean denying your core values. And it does not mean pity, right? Looking down upon others. So I think it's important for us to consider compassion can be fierce. Compassion can be a confrontation. You can say, this no longer serves me. The way I'm always getting down on myself at the end of the day, I'm done. Doesn't help me, doesn't help others. So to be really clear and concise with our compassion, heartfelt care and consideration, and action, motivation, where it's appropriate and necessary. So when we think of compassion in action, right, we can have compassion for our difficult emotion experiences and really think about how do we identify like what made us so upset, get curious and remember it and really get into the context. We could even think about revisiting these destructive emotions with compassion and kindness. So my invitation for you all, if at the end of today, to think of one emotion that you regretted in this last week. Can you apply compassion to it? That is really our strategy for care. So I'm aware of time here, and I am just going to end with saying that this is a really virtuous cycle, these practices we do, that our kindness and compassion allows us to feel connected. Feeling connected is our intrinsic source of meaning. The work feels good because we feel as though we're connecting either to colleagues or to patients and patient families. That sense of meaning gives forth to well-being, which then makes it much easier to have kindness and compassion. So this is an optimistic take, but I hope it's one that you all can feel is of some benefit to both your professional work and your family life. And please feel free to reach out through the Greater Good Science Center or to me directly. And yeah, thanks again for having me.
Dr. Ekman, thank you so much. Oh, I feel like I'm going to be chewing on that for a while, but I did really love the fierce compassion. We had talked about what kind of some of the things we're going to talk about. I couldn't remember the word that you had used about, and I was like, strong compassion. I was like, no, there's something fierce, and I love it because it's like also has like a something really protective about it, as well as passionate. And I love that compassion isn't like the marshmallow image that you can, sometimes you really have to address difficult things in the midst of that. I'm still stewing on this first Q&A question about feeling angry and this boss. So I think we're all stewing on it. We're gonna get to it. So thank you so much, Dr. Ekman. Thank you for that really hopeful talk on kind of really concrete things we can do to be mindful of our emotions and how we manage them during this time. We are now going to move to Joyce Dorado, who's going to talk really about one of my favorite topics in trauma-informed thinking. She's going to tell you all about it and kind of how she got into it and how it's going to be so helpful. And I will just tell you one little plug. I remember when I first sort of came connected with some of this, somebody sent me a video from like Oprah who did like an interview with a bunch of people who kind of looked at this, and she said it was the most life-changing journalistic interview she had ever done looking at trauma-informed thinking. So with that, thank you so much. Thank you so much for coming to share.
All right, can everybody hear me okay? Can you hear me? Great. So I am just going to spend a little bit of time here talking about some of the work I've been doing for a number of years now. Just a little bit about myself. I've been working with trauma-impacted children, youth, and families for 30 years. I've been at UCSF at the General for almost 21 years. Eve, it was so nice to hear you speak. It's always such a treat. And really much of the work I've been doing these days is delivering training and consultation to schools and other organizations about trying to help people understand how trauma can affect any of us as human beings, right? How it can affect our health, our behavior, our relationships, and ultimately our work and our organizations. And what anyone can do, regardless of what your role is in an organization or a community, to actually help ameliorate those effects, to counteract those effects so that we can help others as opposed to inadvertently harming them. And so here's the bad news. The bad news is that trauma is really pervasive. It's gonna affect most of us during our lifetime and during this pandemic. And as we reckon with racial injustice, we see how widespread and really disproportionate that suffering is. That's the bad news. But the good news is, what this means is we all actually have a stake in trying to address the effects of trauma and chronic stress. And we absolutely can overcome and heal from it. And many of us in this call, I know myself, are testimony to the ways that we can actually overcome trauma and come out the other side, wiser, more compassionate, stronger than we were before when we're given the opportunity to heal. And science points us to all sorts of strategies and approaches that can help us to heal and be resilient in the face of stress. So I'm going to be able to touch on that a little bit in this talk. And just to riff on a quote from someone a very wise person who's a resident warrior in the Hope SF program, what she said is something like, if we do not transform our trauma, we are bound to transmit it to others. And so it is really incumbent on us to look to our own healing as individuals and institutions so that we can be helping and not harming. Sorry, welcome to the movement. This is actually, I think of this as a movement. It's a trauma-informed healing center. Okay, we at Hearts have been working with schools since 2008. We have a deep and sustained partnership with San Francisco Unified School District. We've also worked in Oakland Unified and other school districts. We've trained all of the school social workers and nurses in San Francisco Unified. We've trained thousands of personnel there and across other districts. We've touched the lives of thousands of students through this work, through this deep partnership with our educators. And it's such a privilege and an honor to be able to do that. And Hearts, in a conversation that we had with the San Francisco Department of Public Health director back in the day, has, through that conversation, led to a seed for what has become, in the San Francisco Department of Public Health, our Trauma-Informed Systems Initiative, which I'll talk about here in a little bit, but just so you know about them, we, as part of that, we've aimed to train all San Francisco Department of Public Health employees, and it's kind of spread to other sectors in San Francisco, including child welfare and juvenile justice and all sorts of places. And that has in turn led to the seed of Trauma Transformed, which is a regional center that is dedicated to creating more trauma-informed, healing-centered institutions, youth-serving institutions and organizations. And that work involves training, consultation, and really long-term systems change and healing. So what I'm going to be talking about is all part of this big movement, and it's really been such joyful work for me and for those that we work with. So we have a set of principles, of core guiding principles that we abide by. And with these principles, we are really trying to transform our organizations, our places where we work, so that we can create care and work conditions that promote resilience and healing, not only for those we serve, but for those of us who serve them. And we try to apply these principles, these values, if you will, to not only us as individuals and our interpersonal interactions with others, but also to our communities that we live in, that we work in, that we serve, and to our systems and our policies and procedures. So that's what we're going to be talking about here. So just a little word about trauma, just to create, so this is, you should know this is at least a half-day training, days-long training, but we're just going to try to, I'm going to try to create some common language and common understanding. So in our Q&A, we can also bring this forward. There's lots of resources around this, but just to give you a little taste of this, what we know, again, is that trauma can affect all of us, our brains, our bodies, our behaviors. And just a little bit of brain science here. There's this adage, neurons that fire together, wire together. Our brains and bodies are made up of a bazillion neural networks, and these are each neurons. And each time these neurons fire together in this network, they wire together a little bit more strongly, so that over time, this wiring becomes really automatic. It's how we form habits. The thing we do over and over and over again is the thing that we will keep doing over and over again unless we actively try to change that. It's how we learn anything. So that's neurons that fire together, wire together. And what's difficult is that when we are actually under threat, when that's chronic, whether that's because of how we grew up or during this pandemic or as we face daily instances of injustice, it's almost like it wears a groove in our brain that we're much more easily knocked into this survival response, this fight, flight, or freeze response. And that can even happen even when it's just something that reminds our brain of a traumatic experience or something that we're terrified of. Like if someone coughs these days, it's like suddenly this terrifying experience, or a loud noise, or feeling devalued or invisible in our workplace, that this can trigger us into a fear response or survival response. And what's happening inside of our brain, it's a little bit like a rut in a road or a groove in a record. Just think of it like that we're more easily knocked into. And what can happen, if you think of a rider and a horse together, that this makes up our brain. Put again, very simplistically, we have our rider that kind of sits up top our horse. It's in this part of our brain, the frontal lobe. It makes informed, rational decisions and can help us plan and prioritize. And then we have a little lower part of our brain, that's the survival part of our brain. That's the horse that acts on protective instincts and based on feelings. And when you've got integration of all those different parts of our brain, we can actually get really far and ride really far on a horse and get lots of work done. But what happens when we're triggered is the rider is knocked off of our horse, and the survival brain largely takes over. And we see that in brain scan studies. And what we know is that when we're in this rider off our horse sort of space, this survival brain, this happens not only to those we serve, but to us too. And we can cause harm when we're in that sort of triggered, dysregulated space. And the more power we have over other people, whether they're their boss or their teacher or their parent, the more our rider off the horse behavior can actually cause harm. And this doesn't only happen to individuals, it actually can happen to organizations. And so this is an org chart. You don't need to know what everything is in this org chart, but our organizations are made up of living beings, you and I. And when you put a lot of stressed out folks with not enough resources to deal with the stress into an organization, there's a gravitational pull towards disorganization and chaos and ways that we don't work well together, ways that we finger point towards each other, ways that we blame and scapegoat each other, ways that we get really rigid around policy and procedure and sort of fear-based decision making that can really cause harm. Trauma fragments. It fragments our brains and bodies, it fragments our relationships, and it can fragment our organizations. And the problem is that these organizations actually cause harm to us, to those who serve folks, as well as to those we serve. So it's so important to pay attention to the self-care strategies that Eve and Margot and many folks give us. And at an organizational level, we actually need to create work conditions that make it better and more possible for us to take better care of ourselves and each other. And so these are trauma reactive organizations that can be fragmented when we don't address trauma, that can actually be trauma inducing. And we're trying to be more trauma informed, which basically means that we're realizing the widespread impact of trauma. We're recognizing how it shows up at work. We're responding by shifting our practices, and we're doing everything we can to resist re-traumatizing folks through their interactions and work. But ultimately, the big picture prize is not just a trauma-informed organization, but a healing organization, right? That instead of being fragmented, we're integrated with each other, where we take the time to reflect on the meaning of our work, or if we make a mistake, like what happened and how we learn from that. Where people and not, numbers are at the center of the work that we do. Where we can be growth-oriented and really wellness-oriented, where we can be flexible and adaptable to all of the myriads of things that we come up against. And organizations that are equitable and inclusive, where the folks that we serve are represented all up the food chain in our organizations. So this is really what we're aiming at. I want to say here that cultural humility and equity is very central. It's one of our principles. It's very central to the work that we do. And cultural humility is really a lifelong process of reflecting together about the root causes of suffering: racism, xenophobia, sexism, homophobia, these sorts of societal oppressions, and not just being sensitive to them, but also being aware of how they're embedded in our organizations, and then holding ourselves accountable as institutions and individuals to counteract those harms. So we talk about sociocultural trauma. We talk, those of you who are familiar with the trauma field, you know that these are the traumas that I learned about in trauma school back in the day, in therapy school when I was getting my PhD. But these traumas happen in a context, and these societal injustices are alive and well and living in America. And what we know is that our country was built on a history of genocide, of enslavement of people, of segregation enforced by terror, and that these things live on in our institutions. You look at things like the school to prison pipeline, mass incarceration, they live on, right? And so, and as well as in our individual and interactions with each other. And what we know is there's actually a synergistic effect. If we only pay attention to these, these inner circle traumas, but not to the rest of it, we're actually really missing the boat. And that's why for us, addressing things like racial injustice are central to this work. And what we believe is that, for example, if a policy or practice isn't racially just, it's not trauma informed. And so when we think about healing, we know that trauma is historical, structural, political, intergenerational, interpersonal, and embodied. And so our healing needs to be along all of those dimensions. So just a little something that we can try to do as part of our healing around, for example, racial injustice and bias, is to be able to address the conditions that exacerbate the enactment of the implicit biases that science tells us we all have. Right? And what we know is that actually stress, anger, frustration, emotional pain can exacerbate the enactment of our implicit biases. And then my biases come out towards somebody else and actually cause harm. So what we need to do is we need to try to change our work conditions so that we can make what we know is tiring, stressful, distracting circumstances make the enactment of our implicit biases worse. So how do we try to make space for reflection? We try to do things so fast, but when we do that, what happens is we potentially cause harm. How do we try to address and make situations and criteria less ambiguous and more predictable? Because we know that ambiguity and sort of ambiguous rules, policies can actually pull out the ways that bias can harm people. We know that when we are in autopilot and just sort of like, again, making these, not taking the time to reflect on the impact of our actions, this can cause harm to people. We know that the lack of feedback, when we don't have feedback, it can hold us, it can actually make it so that we're not held accountable for these actions. So how do we actively elicit feedback around how are we doing around our anti-racism practices? I'm really pleased and proud of the work that we are doing here at UCSF and here in our department around this. And I really encourage us to all get involved in this. So just to provide you with just a few nuggets of things we can do in our organizations to try to promote the rest of our principles. With safety, what we know is that we can't upshift into our thinking brains, into our best selves when we don't feel safe. And so we must do everything we can to establish physical, relational, and emotional safety, and to make our work environments as predictable and stable as possible. And this involves working to create a sense of safety and belonging for everyone. I want to say a word about belonging. So when we talk about diversity and inclusion, diversity is like inviting everybody to the party, right? Where everybody's invited of all walks of life, of all cultures. Inclusion is making sure that people actually have a seat at the table where decisions are being made. And belonging is being able to, in some ways, help choose the food and the music and what that party is going to look like, and being accepted for our authentic selves, that I can be valued. So I have a quote here: I belong because I work hard and I contribute and I make a positive difference. And I don't have to pretend to be someone else to do that. I can bring my whole self to work and be safe and accepted for that. In terms of compassion and dependability, as Eve so beautifully said, we're hardwired for connection to heal us. How do we make sure that we create opportunities for connection among ourselves, our coworkers, between administration and staff? That ways that we do things like make sure we have a connecting activity, even if it's very brief, at the beginning of every meeting, whether it's an icebreaker or a really brief check-in, or breaking out into subgroups to just say, like a little something, exciting or happy that happened to you that week. We are all working, most of us, some of us, fewer of us, more and more, working from home. This actually gives us an opportunity to connect with each other. Can we welcome the other people in our lives that come through the screen, our children, our pets? That actually humanizes us with each other, right? And it creates connection. If you're a leader, communication is key. How we communicate to those that work for us and with us, how we communicate often, conveying clearly and transparently what we know and we don't know. Listening deeply. It's very hard to speak truth to power. And so unless we as leaders, as managers, actually create and actively invite communication, feedback from those that work under us, and listen deeply and reflect that back and then do something about it, people have a hard time telling us what they need, right? In terms of collaboration and empowerment, trauma makes us feel really helpless because we're overwhelmed by these huge stressors. And so part of the healing is to be able to help people not feel helpless, to be empowered, to feel like they have a sense of agency, that they can do something about their plight. And when we think about how organizations can help heal us, it's about making sure that there are forums for people to have voice and choice. When folks have voice and choice around things that mean something to them at work, we're actually healthier, happier, and more productive. And so how do we make sure that as leaders, as managers, we're making plans with our people and not to them, and not just simply doing things to them? And how do we make sure we really extend and try to engage folks who have otherwise been or previously been marginalized or made to feel like their voice doesn't matter? And ultimately, the final principle here is about resilience and recovery. And that's really about being able to bounce back, from our adversity. And so much of what resilience is facing down the often brutal reality of what is, but also maintaining a staunch optimism that we can overcome it. So holding on to that hope. How do we build wellness activities and strategies and good news into our meetings, into our regular everyday schedules? And how do we honor and draw upon the strengths of our staff and community? It's not just about what has happened to you, as Margot was talking about, but it's also about what has gotten you through. How do we share that with each other and honor it and bring it into our regular work day? So there are many, many resources that are in my slides that I'm happy to share. But I do want to sort of leave on this hopeful note. We are going through some very hard times, and there are still hard times ahead, but I really believe that if we can work together, if we can act with thoughtful intention about how we can help others instead of inadvertently harming them, if we can lead with love in all of our interactions, if we can reflect on what we're learning through all of these hard times, that we actually can get through this stronger, wiser, and more compassionate than we were before. And I want to leave you with a quote at the end of a poem by Laura Kelly Finucci. What she says is, "When this ends, may we find that we have become more like the people we wanted to be, we were called to be, we hoped to be. And may we stay that way, better for each other because of the worst. Thanks for giving me this opportunity to speak to our participants, Margot.
Joyce, thank you so much. I think one of the main reasons that I really wanted you to come speak and to speak on this topic, and I wanted to share this topic, which is a huge topic, and I feel like you worked really hard to distill it, is because I feel like it's really hopeful. We are hurting and traumatized. And yet I really do believe that there's hope. And I love that you said that this is a movement, and there's some great questions. There's a question about how do you do this? I think you had a slide on that, but there might be some more questions. We have about 16 minutes for our Q&A. So I wanted to quickly introduce our panelists. Thank you, Dr. Ekman. She had to leave. There was something that she had to take care of. We on the flyer, Hez Wolin was also supposed to be on the panel, but also had to be excused. And we let them go freely, knowing that their wellness is so important. But Joyce will be here to take questions. And then we have Dr. John Brown, a clinical psychologist who is part of the faculty and staff assistance program, has been partnering with COPE during this time. Dr. Tammy Duong is with us. She is a geriatric psychiatrist. And we know that our older loved ones have been struggling greatly. So I wanted to make sure you guys had some access to someone for your questions. She's also does some other roles in adult outpatient at Langley Porter. And then we have Lisa Fortuna, who is also a psychiatrist and chief of psychiatry for Zuckerberg San Francisco General, and is a vice chair for psychiatry for our department. And so, yeah, we just want to open up to questions that you have for us. I want to kind of start by just saying, like, I think Eve, while you guys kind of fill out some questions, I think Eve touched on the question about, I think the first question, which was having a manager that is not really, you're not really feeling supported by your manager, and they don't really seem to get how you're doing. That comes up a lot in questions. And so, and that can be really difficult. And Joyce, you made the comment about speaking truth to power. I think one thing Eve said was, you know, if you have the option of not going to those meetings, make that choice and reserve your energy. For those who don't have that, anyone have any recommendations on how to deal with a manager who's not being supportive? It's a tough one.
I'm happy to jump in on this. Thank you for having us, FSAP. We're really glad to be on the panel here today. So there are a number of resources within the university, depending on the situation with each manager and the employee. But the one that comes, I'm a biased representative, but there's the one that comes to mind immediately is my program, which is the systems program. And we often work with folks who are in that sort of conflict, how to cope with that in conjunction with whatever else is on that employee's plate. And while we can't change the other person, we can't change their behavior, we can learn how to cope and how to take care of ourselves while hopefully change is happening. The other resources in the university, like the Office of the Ombuds, is a great way to kind of get some practical, meeting with them to get some practical skills about how to talk to your manager if you're comfortable doing that, or potentially even taking part in a mediated conversation between the two of you. And then if things are actually progressing farther than just conflict, and it's more about potential harassment or bullying or discrimination of some sort, we can help folks get directed to the resources within the university where they can get support and allyship in those areas.
Thanks, John. And I just want to acknowledge how difficult it is. It is really difficult to think about how you might use that fierce compassion to stand up and say, I need something different from you. manager, that can be really difficult. So thank you for those resources, John. I think that's really super helpful. I think another question that had come up was, and this is kind of different than some of the questions that were there, but just, you know, a lot of people are struggling with kind of substance use during this time. A lot of people have been sort of at home, not have accountability, and are struggling with this. We got some questions beforehand, for people who registered. And this was one of the questions that had come up about, you know, what do you do if you think there's a substance issue that you're struggling with?
I mean, this is Lisa. You know, I think it is a big problem that, you know, for one, people shouldn't feel alone in, because it's becoming quite a prevalent concern and issue. Different ranges, right? Where people are feeling like, you know, kind of slipping into a little bit more drinking and then really sort of wondering if they have a problem. And I would really sort of support people in seeking consultation, professional consultation, and being able to, especially if they think that it's getting into a realm where it's starting to impact their well-being, right? Either physically or emotionally, functionally, like how they can do things. Because of it. And I always recommend sort of, you know, having someone to sort of really reflect with that professionally. And then, you know, I think that's an important step in taking care. And, you know, and I think that's a common theme that we have throughout this talk is really, and it even goes with the emotional granularity, right? Like what is happening? What am I experiencing? You know, when I am drinking, or whatever, you know, substance, you know, what's taking me there, right? What am I feeling, you know, when I feel like I need to do that, or when I do it, right? And then asking for support and help if it looks like it's falling into a way of trying to compensate with some other pain and difficulty.
Yeah, thank you so much, Lisa. I mean, I think it is incredibly common. It's definitely come up in town halls. I think it's a really difficult thing to acknowledge or share or talk to someone about. And I think getting professional help can be really helpful. I think a good step often is talking to your primary care provider, and that can be a good first step in a place that people might feel safe. I think another question that had come up kind of earlier was just sort of being a caregiver and being exhausted about that. I'd like to kind of, I've heard certainly a number of my colleagues talk about their elderly parents and how difficult that has been during this time. You know, some people are getting vaccinated, which is really exciting, but it's been really difficult. Tammy, could you share some wisdom with us about kind of some tips that we can think about to help with some of these issues? And like, what are some of the most common issues that you've heard come up again and again?
Yeah, thanks again for having me here, Margot. And this is an issue I see pretty much every day, every appointment for me since this pandemic has begun. And it really, for me, it becomes about treating both the patient and the families. And so for the older adult, what I see is, you know, there's a lot of isolation and just a lot of boredom that's been happening. Caregiver side, it's a lot of exploration of, oh my gosh, there are just so many things to do. You know, I've got to take care of all these things and take care of, you know, my elderly, you know, loved one. And I think those lines really start to blur, especially for the caregiver, and where the needs of everybody else all of a sudden becomes their needs. And, you know, I've had some patients too, where we're sitting there talking and I'm trying to talk about them, and all I hear about is, you know, the other person. So for those folks, and especially for the caregiver, I really ask them to stop and reflect, you know, where do they end and where do you begin? And where are actually your needs? And sometimes when families are first become caregivers, right? They don't really know what to expect. And some of my advice is to just assume at some point you're going to be burned out. And before that happens, think about, what are the things you need and where are your limits? And then you can actually start to plan ahead of time, because it's always a lot worse and a lot more terrible trying to play catch up, right? Than actually saying like, I'm going to need help. And I know I'm going to need help when X, Y, and Z happens, right? And so then you can start to prepare yourself like, I'm starting to get close to, X, Y, and Z. It's time for me to call in, the help from my sister, the help from my brother, right? This is where I need more people around me to rally. So that's the advice I give, to really kind of be aware of where your boundaries are, where that person ends and where you begin, and what are the things that you need and how you can put those in place beforehand.
If I could just say something, like, what Tammy is saying, I feel so the analogy I have to that is, when you're exercising and you wait to be thirsty before you drink water. It's sort of that kind of emotional analogy, right? That we need to sort of take care of replenishing, right? And sort of seeing what we need before we're actually even aware of the thirst. So, that's one of the.
It's also really useful to think about the role that shame can play in that circumstance, because we feel sometimes like we should be invincible and we should be able to tackle, especially for someone we care about, we should be able to tackle the situation. And so then we deprive ourselves unnecessarily of the self-care we need in order to meet this noble goal. And there can be shame in that. I'm not strong enough. Other people seem to be able to do this. Why can't I? That happens in these caregiving, when our jobs are as caregivers as well. Nurses, physicians, seeing other people around them seeming to be able to do the job without any impact, but they're noticing this within them. So a big part of what we need to do is normalize this experience. This is a really difficult time on top of already difficult and challenging situations that each of us might be in our personal lives. And there's no shame in that.
And I just like to remind folks that caregiving in and of itself is a full-time job. So it always seems strange to me that we expect people to do multiple full-time jobs. It's just not a realistic expectation. And I know families have a lot of hard time, admitting when they need help, right? And I just like to point that out, that, sometimes we pay someone full-time to, do this job. Why are you doing it, for free? Where's your help?
Thank you, guys. There's a question about how we deal with coworkers who are getting burnt out. This is about getting non-responsive to emails, but this could be anything. Like, you notice a coworker is burnt out and they're just not functioning as well as they used to, or you need them to.
I think that for sure, that frame of, instead of what's wrong with you, what has happened to you, is really, really helpful. And actually even maybe asking your coworker, like if they are really snappy with you, snappy with you, to just really be able to ask them, like, are you okay? You don't seem yourself these days. Is there something I can do to help you, or some help that we can try to get? Because we're all really struggling. And frankly, I might look good on the outside, but I'm freaking out on the inside. Like, to be able to share some of that vulnerability so that it doesn't feel accusatory, and it really just helps them realize that, like, we're all struggling, and that does sometimes have an impact on how we treat other people. So are you okay is a really good first question.
Right. And I say from organizational, which gets to one of the other questions of, like, how can organizationally we deal with this? Again, being proactive about it, right? So at least in my department, I'm trying to start our meetings with check-ins, right? Like, let's just sort of put out, like, how are we doing, right? Because sometimes people feel like even if we ask, are you okay? They're like, well, I'm not going to get into it. And so what I do is, I say, let's just do a check-in. And even if we put in the chat, how we're doing today, and I'll put mine, right? And it might not be happiness, right? It might be like, I'm stressed and, this is tough, but, and just put it out there so that we can even start the conversations knowing we're dealing with a lot of emotionality right now. that's real and reasonable and understandable, and we're putting it on the table, right, as we even start the conversations.
Yeah. So I think I'm going to just take this last question about, I think the very last one is about the organization. Everyone's dealing with overload across all positions, budget crisis. Someone's saying that supervisors are even more stressed out than the worker bees. And can we take this up to, top leadership? I want you to hear me say, because I've talked to people in like every kind of rung, if you will. This is just an incredibly difficult time at UCSF and across many organizations. We are struggling financially because of many different aspects of the pandemic. And so it is just incredibly difficult. And so what I think is so important is to remember you can only do what you can do. And if you are continually pushed past your limits and you really cannot, I think you can communicate that. I am really giving you everything I've got, boss. And I'm putting on my oxygen mask first, but I don't have any more to give. And I don't want to leave, but if you ask me to do more, that's what comes to mind. And I know that's true because we've all seen the attrition. And I'm probably not supposed to say this out loud, but it's true. This is what we all kind of think about and face and deal with, is how much can I keep doing this? And that's why I say, put on your oxygen mask first. And if you have hit your limit, express it. Because probably the person that you're going to express it feels the same way. Thank you so much. I just cannot say enough how grateful I am for all of the panelists and speakers, but also for all of you who are listening. These times are so difficult. We are sincerely grateful for the job that you do at UCSF. Please take care of yourself. Over to you, Colette Onoko.
Thank you so much, Margot. And on behalf of the rest of the planning committee, I'd also like to close today's webinar by just showing gratitude to all of our speakers and panelists for their insights on how we can take care of ourselves and one another now and going forward. I'd also like to thank all of you participating today for the many ways you've been showing up and holding it together for the UCSF community despite facing ongoing struggles. We hope to continue working together on staff-led collaboration like today's event, so please be on the lookout for future events and feel free to reach out to the planning committee if you have ideas or suggestions that you'd like to share. Thank you again all for joining us today.